Well, it is 10 minutes, we will just shout because there is no bell here, okay?
First of all, I'd like to thank the organizer, especially Gautam Das, and also the Bangladesh coordinator, Dr. Kausar Sardar, on behalf of me and Bangladesh Association of the Physical Medicine and Education, to give a chance to give such a lecture in this audience. My topic is physiatric approach to low back pain, that's back pain and limitation of the physical therapy. Back pain is one of the most common elements of mankind. 80% of the people will experience back pain at some points of their life. Disability from back pain has increased in the last 30 years. Only a small number of the patients have a clear diagnosis. Spinal anatomy review. Four major regions are involved in the back pain, that is cervical, thoracic, lumbar and sacral region. More common causes of the cervical pain are cervical strain and cervical spondylosis. Thoracic pain or upper back pain are mostly caused by myofascial pain, joint dysfunction, compressive fracture and ankylosing spondylosis. Most important part of the back pain are the lower back pain, which are responsible for muscle strain, degenerative disc disease, lumbar disc herniation, spondylolisthesis, lumbar spinal stenosis, and lumbar sciatica. Only 15% has a specific pathology, but most of the back pain is usually 85% have no specific pathology. Now, going to the given any type of the therapy, like any diseases, physiatric evaluation is important. Along the physiatric evaluation, thorough history taking, physical examination, and relative investigation are important. During the history taking, location of the pain, duration of the symptom, onset of the symptom, characteristic of the pain, especially mechanism, inflammatory or radicular type, relevant or accident factor important. And also neurological history, weakness and numbness and constitutional symptom are important. Physical examination should be standing, sitting or lying position. In standing position, we should definitely see the scoliosis, kyphosis or flattening of the spine. On standing or sitting position, we should see the tenderness of the spine. On mobility test, one of the important tests in case of the low back pain, first the flexion test, extension or hyperextension, then the side-to-side movements also important. Increased discomfort with the hyperextension is noted with facet joint involvements and spinal stenosis, relieved with forward flexion. Disc disease lateral flexion is often bizarre, while forward flexion is not. Another important test are the 10-toe rise and the toe walking. And the heel walking and the heel raise also important one. Squatting test is important one. And sitting posture, straight leg rising test, muscle power testing with or without resistance is important one. Skin test should be performed. Ankle jerk or jerk should be tested. Lying condition should be another test. Flavor test, that is, should be detected the hip pathology. Lying lying condition, straight leg rise test, crossover test is also important. First of all, ankle stand. Approximately 110 to 120% of the ideal body weight for the male and 80 to 90% for the females. Normal extension to the flexor strength should ratio 1.2 to 1.5. So, UPFN can be evaluated by qualifying spinal range of motion, assessing ankle strength and lifting capacity. Now, we should go to the differential of the diagnosis. Our important one, either it is mechanical or influted. In mechanical, back pain should be some characteristic. Pain varies with activity, improve with rest, and limited to the back and upper leg, sudden onset, should be recurrent, not root distribution, and no systemic feature. Now I highlight some important causes of the low back pain usually. Spinal causes usually mechanical back pain, which is our most considerable one. Musculoligamentum strain, degenerative disc disease, spondylolisthesis, and spinal stenosis are the most important. Some causes of the inflammatory conditions and infections are also important. Some metabolic causes also important, like osteoporosis, hyperparathyroidism, and renal osteodystrophy. Some neoplastic causes also important, Corticomegaly syndrome due to the cord and tumor, multiple myeloma, metastatic malignancy. Non-spinal causes also important, visceral causes, pyelonephritis, etc. Also should be considered that some red flag sign, what is the most important in all kinds of the physicians, that was is if greater than 50 or less than 20. Constant progressive non-mechanical pain, thoracic pain, persistent severe restriction of the lumbar flexion, pain that worsen in supine position, bladder and bowel symptom, widespread neurological symptom. And also unexplained weight loss, night pain, poor general health and systemic symptom, fever, previous history of the cancer, no relief with bed rest, failure to improve therapy. This is a red flag sign. It should be highly considered in low back pain. Now, we should, some question arises. Is systemic disease causes? Is there psychological distress that prolong or amplify the symptom? Is there neurological compromise that requires surgical intervention? Now, we require some investigations. If red flags are present, definitely we should go to some investigation. That was CBC, ESR, CRP, RFT, LFT, and some serological test, plain X-ray, MRI, CT, and CT myelogram also important. Before going to the treatment, we should now consider about the whole management. That is the reassurance, educations, pharmacotherapy, physical therapy, intervention like injection, and also the surgery. I like discuss about the only physical management, and important one of the physical, basic physical therapy, active physical therapy. Basic physical therapy helps to reduce the pain. Some physical modalities used to reduce the pain, that is the thermotherapy, electrical stimulation, and ultrasound. Cervical traction and lumbar traction also important. Active physical therapy for back pain exercise, postural correction, lifestyle modification, and ergonomic modification. Therapeutic heating, one of the important to relieve the pain, that is the hot pack, paraffin wax bath, hydrotherapy, IRR, that is radiant heat, laser, and we use also some deep heating modalities, that is microwave diathermy, shortwave diathermy, and ultrasound. muscle spasm. And also heat increases the blood flow that assists to resolution of the inflammation, inflammatory exudate and edema. And it also has some soothing effect. That is the IRR, that is the laser therapy. It is short wave diathermy. It is the deep heating modalities, which depth of penetration over 2 to 3 centimeter. It is also deep heating modalities, microwave diathermy. It is ultrasound therapy. It is also deep heating modalities. It is a transcutaneous electrical nerve stimulation which causes
last 3 minutes. Last 3 minutes.
It is a traction. Traction therapy is controlled weight, the force applied to the cervical and lumbar spine to get the beneficial therapy effect. And it will apply to the 10 to 15% of the body weight in case of the cervical traction and 30 to 16% of the body weight in case of lumbar traction. Traction are used in case of cervical spondylosis, cervical brachydactyly, chronic lumbago-sciatica and thoracic outlet syndrome. Lumbar traction, cervical traction. Now we go to the some therapeutical exercise which we use the McKenzie method. Overall program of the assessment treatment of the prevention strategy comprise set of the exercise, reduce pain by stabilizing the spine. Some back exercise are stretching exercise, strengthening exercise, spinal mobilizing exercise and aerobic exercise. Here are some exercise. This is the back exercise. This is the spinal mobilizing exercise. This is the exercise in the breathing condition. This is the spinal exercise. This is also the exercise for kneeling condition. This is exercise in the rolling exercise. And now I highlights to some limitation of contraindication. Heat. In case of heat, absolute contraindication of the tuberculosis and malignancy, and some relative contraindication are the anesthetic area, child and infant, bleeding disorder, and inadequate vascular supply. Contraindication of the traction are the joint and ligament instability, tuberculosis of the active bone disease, tumor and the cancer, and the gross osteopenia. And contraindication of exercise are mechanical joint provoked by the movement, joint movements restricted or malalignment, acquired disc disease or muscle imbalance or tightness. Now I like some limitation of the physical therapy. All contraindication of the physical therapy should be a limitation of the physical therapy. Anemia, also a limitation of the physical therapy. Swelling and the painful condition is not allowed in physical therapy. And it is definitely a lack of long-term efficacy. There is no long-term efficacy. Slowly recovering, lengthening the time spent, no guarantee of the complete resolution of symptom. Epidural injection used in back pain due to the disc disease, facet arthropathy and sciatica. The goal of the injection is a pain relief, and epidural can be